My name is Dr. Alozie Ndubuka. I'm a medical practitioner at St. Ives Specialist Hospital. I am a general practitioner and a member of the West African Postgraduate College of Surgeons. The importance of my area of specialty in St. Ives, general practice and surgery, is that we take care of cases that come into the hospital that may require surgical interventions and surgical advice. We prep them, we supervise the procedure, and we deliver quality surgical care to such patients.
My name is Dr. Kingsley Obodo. I'm a consultant obstetrician and gynecologist, a graduate of College of Medicine, University of Lagos, a fellow of the National Postgraduate Medical College of Nigeria. I'm a consultant obstetrician and gynecologist, like I earlier said, and with key interest in fertility. So I'm a fertility expert.
Yes, my name is Dr. Lawrence Oshogwe. I am a medical practitioner. I graduated from the prestigious University of Benin with an MBBS, which is a Bachelor of Medicine, Bachelor of Surgery. In St. Ives Specialist Hospital, I am the head of the pediatric unit at the Salvation branch. Yes, the importance of my specialty in the total healthcare promise for St. Ives has to do with, taking care of babies that are delivered in St. Ives and children that are registered in family, because we get to take care of the whole family. And we come in contact with a lot of babies that require very good state-of-the-art neonatal care, and I am responsible for taking care of them. And we've been making headways in terms of helping couples achieve that which is most important to them.
Ezobina Charles is my name. I'm a family physician, and working with St. Ives has been a great opportunity for me.
I am Dr. Ede Edopolo Osao. I am a consultant gynecologist and also an obstetrician. I did my first degree from the University of Benin, where I obtained my Bachelor of Medicine and Bachelor of Surgery. I did my fellowship at the Lagos University Teaching Hospital, where I obtained my Fellow of West African College of Surgeons, and I also have the fellowship in Postgraduate Medical College of Nigeria also. And I work as a gynecologist for the past 6 years, 5 to 6 years.
My name is Mrs. Ibokwe Ogechi. I'm a BSc holder in statistics from Abia State University. I also have 2 master's degrees, one in business administration and the other in operations research from University of Lagos. I belong to the Nigerian Institute of Management, and I've been attending so many courses in related fields ever since qualification. I'm an administrator with St. Ives Specialist Hospital, and basically we provide the administrative support to the medical team to ensure that we give the very best of personalized care to our patients at all times.
My name is Zola Omiorotimi. I'm the Chief Nursing Officer of St. Ives Ikoyi branch, and I'm married with kids. I'm a registered nurse midwife, and my area of specialty is midwifery. Well, the importance of my specialty in total health care in St. Ives. St. Ives is a family clinic. So apart from every other thing, we do a lot of deliveries. And being a midwife, it has really helped me to widen my scope because of the number of deliveries we have. And again, I am the counselor in the IVF unit. So this again has helped me to gain more knowledge and to be able to bring patients along with their treatment in area of IVF?
My name is Ozioma Chukudi. I hail from Anambra State. I'm the first of a family of 4. I have degrees in microbiology and public health. I'm an embryologist the clinical embryologist in St. Ives Specialist Hospital. I've been the clinical embryologist for the past 6 years. I've had my trainings both locally and internationally. And I have a passion for completing families, for assisting couples that have challenge with infertility to have take-home babies. My favorite quote in life is, what will be, will be. The importance of my specialty to the total healthcare promise of St. Ives is to actually help couples that have challenge with infertility, have take-home babies. Infertility is known to be a major healthcare challenge in Nigeria now. So what I do as a clinical embryologist is to help couples who have this challenge with infertility have take-home babies by doing in vitro fertilization of eggs and sperms outside the body and transferring back embryos into the uterus of the women. And then they have take-home babies, and that's the importance of my specialty to the total healthcare and promise of St. Ives.
My name is Tunde Okewale. I'm an obstetrician, also a gynecologist. I'm also a fertility expert. I am the CEO of St. Ives Healthcare Organization. We started St. Ives in 1996. That's roughly 22 years ago. I've been practicing medicine for over 30 years, and I've been a gynecologist for over 25 years. I'm a fellow of the Royal College of Obstetrician and Gynecologist in the United Kingdom. I qualified as a member in 1992, and I've been practicing obstetrics and gynecologist since then. My main specialty or subspecialty is fertility medicine. It's been a good experience running a modern hospital like this in Lagos, Nigeria, after having practiced for over 10 years in the United Kingdom. We've had many successes through normal delivery in our unit. St. Ives Hospital basically caters to 3 aspects in healthcare. We are committed to women care, family care, and children care. And everything we do revolves around those 3 areas of medicine. The uniqueness of St. Ives is it's a modern hospital. We have presently 4 branches, one in Ikoyi here, one in Ikeja, 2 in Ikeja, and another one recently that we opened in Abeokuta. It's been quite an interesting journey setting up St. Ives. We started in 1996 in a 3-bedroom flat in Ikeja. When we started, it was basically a women hospital because I'm an obstetrician and a gynecologist. I came fresh from the UK to set up St. Ives Hospital. Over the years, when we treat the mothers, when they deliver, when they have their children, they want us to take care of their children as well. And so our pediatric unit evolved from there. When we started treating the mother and the children, the fathers come along. And from then again, the family aspect of our practice came into fore. We've gone a long way. Presently, we have 4 hospitals. We have 2 specialist hospitals, one in Ikeja, one in Ikoyi. Our first family hospital is also in Ikeja. We have a clinic in Abeokuta that caters to the reproductive health of people in the area. We've had many successes. As at the last count, we've had over 2,000 babies through our IVF unit, and we've lost count of the number of babies through normal delivery in our unit.
Well, St. Ives has been quite an interesting place to practice medicine within the Nigerian context. We do give quality care to our patients, and we work as a team in this hospital. And the joy of the staff of St. Ives manifests in the performance of their duties and in the service to their patients.
The experience in St. Ives has been tremendous so far. The journey so far has been quite pleasant.
Right from inception up till now, I have enjoyed every single day in terms of the work staff, in terms of the patients, in terms of achieving the goals and objectives that have been set and that is targeted by St. Ives Specialist Hospital. And this entails just more than just delivering good healthcare services.
Working in St. Ives has been a very good experience. At least I've had so many patients that have come in and they delivered safely, and we have also been able to reduce the incidence of infertility by our fertility program.
The past 5 years working with St. Ives Hospital, I have a lot of good colleagues we're working with. The environment too, it's been quite friendly, and of course the management team has been wonderful.
In St. Ives, it has been so wonderful. I've worked here for about 6 years. We are getting better every day, so to say, in St. Ives, in area of health care to our patients.
It's been a very wonderful experience in St. Ives Specialist Hospital, I must say. For the past few years, I joined St. Ives. It's a very nice place to actually work in, somewhere where you can be free to do what you want to do, somewhere where you can explore your career, grow, be trained. St. Ives has given me the opportunity to exceed my limits, to see what I'm capable of, and it's been a very wonderful time at St. Ives, I must confess.
We are unique in the sense that we value our patients. We carry our patients along in every procedure we do. We make the patient understand that he or she has the right to quality care. He or she has a right to know what is being done on him or her and why the doctor or doctors have chosen to treat him or her in the way so chosen.
We have a friendly environment where you can easily get in touch with each section of the unit, and we work as a team here.
Here in St. Ives, there is something unique and effective that has been working for the hospital, and that is what the relationship St. Ives have tried to adopt in managing their patients. It has helped the hospital a lot, and it has made them to stand, among the crowd.
St. Ives is unique in the sense that it has helped in managing many different cases of infertility, especially those women that have endometriosis. Success rate is very high. These women get pregnant with our IVF programs.
St. Ives practice is quite unique in so many ways. It's a center that gives its clients the very best of care, in a very friendly environment, which is what you hardly find in most centers. And apart from that, the center also makes use of very competent personnel, and of course ensure that it deploys the basic technology, the latest technology and skills in actually rendering care, to its clients. The key thing is that the center ensures that the patients, the clients, get the very best of care at all times in a very friendly environment.
The uniqueness of St. Ives Hospital is this. We're very, very concerned about the ambience of our setting, the hospital. We believe that treatment of patients is not just taking medicines and the rest. the social environment, the environment in which they are treated is also very important. So when you enter any St. Ives hospital, the first thing you notice is the ambience. The second is the neatness of our staff and how courteous they are. We go to any extent to make sure the equipment we are using are very modern. We go to any extent to make sure our doctors and our staffs are well trained, and continuous training still goes on in the practice. Like I said earlier on, St. Ives is noted for basically 3 aspects of medicine. We are noted for our women practice, we are noted for our children practice, and also for the family practice. In our women practice, we've gone a further step ahead to even offer fertility services. And that's what brought about our IVF and fertility unit. We've had, like I said again earlier on, we've had over 2,000 deliveries, IVF babies from our fertility unit since inception.
Many doctors are restricted in the scope of care because of affordability of drugs and other procedures by the patient. The government has a role to play in this. Nigeria is a signatory to the African Union 2001 Declaration on Health, which suggests to African countries to budget at least 15% of their annual budget to healthcare. If this is done, probably healthcare will improve much more in Nigeria than it is now. At St. Ives, despite these challenges, we have devised systems to rise above them, systems to assist our patients who might be financially challenged, systems to also educate our patients on the dangers of self-medications and also on the dangers of relying alone on prayers without working.
Our plan for the future is to have as many branches as we can spread all over Nigeria. We know it might be a bit difficult using our own funds for that. And we're looking at different options in which way to expand the practice.
People should seek healthcare in a center that have all the facilities, that have all the manpower. An example of such good health center is St. Ives Hospital. Thank you.